Let's see, hospital discrimination. Let me start with, in 1989, I was diagnosed HIV positive, and I lived in New York, and I got my diagnosis from the Community Health Project, which was part of the Gay and Lesbian Community Center in New York. So the staff there, the nurses, the doctors, everybody was either gay or gay friendly, and I never experienced any discrimination there. They were wonderful, nice. The harassment more than discrimination that I experienced was in the hospitals in New York with my friends, my lovers, people that I had to endure the hospitals with. So the first incident was with my friend John, who had pneumonia. Pneumonia was pretty common at the time for people who had AIDS. Usually you went to the hospital and 21 days later you were dead. And it was very common actually. So John had been in the hospital probably, I don't know, maybe a week or so at that point. And me and my friend Ross were visiting him. So there were two of us. I think it was Ross. He had some difficulty breathing. John started to stop breathing. And so bells went off and the nurses came in and they didn't say move out or push away or you need to be out. They just literally pushed us out the door. And so they left the door open and so we could see what was going on. And they took this pipe, about so yay big, and just with no anesthetic, no calm down, no, everything's going to be all right kind of thing, just shoved it under his rib into his lung. And I guess the idea is it's a vacuum and it pulls the lung or expands the lung so he can breathe. But it was a really horrific event that probably could have been handled better. This was Beth Israel, not that that's a bad hospital or anything like that, but they were very rude. And maybe they were just overworked, I don't know, but they definitely didn't handle that very well. They weren't nice about it, and I think sometimes a lot of the harassment was more AIDS harassment than gay harassment, but I guess the two were very tightly combined at the time. Second incident was with my friend Kelly, who I had known since I was 4. We met in kindergarten. We grew up together, and he and I both lived in New York. We lived in the same building, and he got sick, and he had an episode of pneumonia. This was probably his 3rd episode of pneumonia at that point, and he called me. It was 5 in the morning, and so I ran downstairs to take him to the hospital, and he couldn't walk, so I literally had to carry him to the cab, who rushed us off to Cabrini Hospital. That's where his doctor was at. And so we went into the emergency room to try and get him settled in, and he can't walk, he can't breathe, he was dying right there. And they planted him in front of this woman, and I use that word lightly, who just, I need this, I need your name, what's your social security number? She was just screaming all these questions at him because he couldn't hear and he couldn't breathe, so he couldn't speak. And so she thought because he wasn't speaking, he couldn't hear. Well, so I'm standing there, and again, I've known him since I was a kid, and I know everything about him, so I knew all the answers, so I just spouted off the answers, and she said, are you his family, are you his brother, something like that. And I was like, no, I'm just a friend of his, but I've known him for a really long time. And she said, you need to get out of here. And so I was like, he can't, you're harassing him, he can't breathe, I can give you these answers, I know him. And so she's like, get out or I'm calling security. And I was like, I'm just trying to help, I'm just trying to, my friend is dying right here. At this point, he's keeled over. Can't breathe, and this person thing is yelling at me to shut up. And so sure enough, she called security, and they drag me out, and I get thrown out of security, get thrown out of the emergency room. So I don't know what's going on. So for about 4 or 5 hours, I have no idea what's going on. This is back in the late 80s, so there were no cell phones. So eventually I made my way home, and Kelly did call. They had gotten him a room, and so I rushed back and got to see him in the hospital. But the emergency room thing was really, that was definitely something where I guess if I had been married to him, not that I would have been, because he was definitely just a friend, but my best friend, they were definitely harassing us because of the gay thing, because of the I think that was definitely more of the gay thing than the AIDS thing. And then the last horror was at Cabrini Hospital in 1990. My friend, my one of my partner at that point, Henry, was in the hospital, and it wasn't pneumonia. He had had so many other things going wrong, and he'd been in the hospital for 9 months, and for 9 months I was there just about every day. His mom was there every day. His father was there. We were very good friends. They liked me. We got along all very well, and the nurses certainly saw me there, washing his hair, cutting his hair, cleaning his diapers, changing the sheets, doing all those things that people do when their loved ones are very sick and dying. And so this one day, June 13th, I remember it very well, I was at work, and I worked uptown, and the hospital was in the village, so I jumped in a cab. I got this feeling at 2 o'clock in the afternoon that I really needed to see him, and so I jumped in a cab and ran down to St. Vincent's Hospital, which ironically is in a gay neighborhood, and you'd think be a lot more gay friendly, but nevertheless, I ran up to the room, and there was no one in the room, and so I ran back to the nurses station, all those nurses who had seen me there for 9 months, and I said, "What happened?" And they, for the most part, looked down and said, "Well, I'm sorry, I can't give you any information because you're not family." And I lost it, and I'm pretty sure I threw things, but I definitely spewed every curse word I'd ever heard, and probably made up some. And they did, again, call security, and again, one of the many hospitals I was thrown out of in New York for this sort of thing, and that was definitely one of those things where, maybe they were just operating by their rules, and to a certain extent, I guess I can cut them some slack for that, but it was pretty fucked up. Because they knew who I was, and they were just difficult about it. So again, pre-cell phones, I ran across the street to a payphone, called his apartment, and his parents had just gotten home, and they let me know that he had died. And so I mean, there's no way to say that death could be there's a good way to find out, but that could have been handled much better if they had not been so homophobic. And I do want to close with, on a positive note, that about 5 years ago, I had some interaction with some medication, and I got very sick, and I started foaming at the mouth and difficulty breathing, and so honestly, I don't remember any of it. This is more from what Rob, my partner, tells me. So the ambulance came, I got taken to the emergency room in Ocoee, which is very close to where we are, and so I went to Health Central in Ocoee, and he has told me that from the moment he got into the emergency room with me till the point that I was discharged, they were very nice, and they took his word for who he was, and had him there for all the medical decisions. It was really bad. I was in intensive care, and I was on a breathing machine and all kinds of horrible things. At one point they thought I was brain dead, and it was just really, really messy. But the good news of that was he was able to be there throughout the whole thing. Now, a few years before that, we had actually gotten all our paperwork, the living will and power of attorney and all that stuff. We had all the lawyers do all the paperwork, which we have to do because we can't get married. And we're concerned that this would happen because both of us had experienced the instances that I talked about earlier. So, but he didn't need that. A few years ago, despite the fact that we didn't have a domestic partnership registry here at the time, they did not ask a thing. They were very cool about the whole thing and made what was a pretty horrible experience less horrible than it could have been for Rob.